What causes cryptogenic stroke in adults? Imagine a stroke happening, but doctors can't quite find the reason why. That's what makes a cryptogenic stroke so puzzling. It's a type of ischemic stroke where the blood flow to the brain is blocked, but even after thorough testing, no clear cause is identified. These strokes can account for about 15 to 40% of all ischemic strokes in adults, making them more common than many realize. The word cryptogenic means hidden or unclear, which reflects how tricky it can be to find the root cause. Even though the cause isn't obvious, researchers have identified several potential underlying factors. One major area involves the heart. Sometimes, irregular heart rhythms like atrial fibrillation can cause blood clots to form in the heart. These clots can then travel to the brain and cause a stroke. Interestingly, atrial fibrillation can be intermittent, meaning it comes and goes, making it hard to catch during standard tests. Another common heart-related cause is a small hole between the upper chambers of the heart called a patent foramen ovale. Nearly a quarter of adults have this hole that didn't close after birth. It can allow blood clots from the veins to bypass the lungs and enter the brain circulation, leading to a stroke. Other heart issues like atrial septal aneurysms, enlarged left atria, or weakened heart muscles can also increase risk by promoting clot formation. Less often, infections of the heart lining or tumors can be involved, but these are rarer causes. Large arteries in the neck and chest can also play a role. Plaques made of fatty deposits in these arteries or in the aortic arch may shed small pieces called emboli. These emboli can travel to the brain and cause blockages, even if the plaques aren't severe enough to be obvious on scans. Blood that tends to clot too easily, known as hypercoagulability, is another factor. Conditions like antiphospholipid syndrome or inherited clotting disorders can make blood more prone to forming clots that might travel to the brain. Sometimes, a tear in the wall of an artery, called an arterial dissection, can cause a clot to form and block blood flow. Though less common, systemic diseases like vasculitis or inflammation of blood vessels can also be involved. Because cryptogenic strokes are diagnosed when other causes are ruled out, doctors often perform extensive testing. This includes prolonged heart monitoring to catch intermittent atrial fibrillation, detailed imaging of the heart and blood vessels, and blood tests for clotting disorders. Finding the exact cause is important because it guides treatment to prevent future strokes. For example, if a clotting disorder is found, blood thinners might be recommended. If a patent foramen ovale is suspected, closure procedures could be considered. In summary, cryptogenic strokes often stem from hidden sources of embolism, like undetected irregular heart rhythms, small holes in the heart, or plaques in large arteries. Sometimes blood disorders or arterial tears are involved. Despite advanced testing, the precise cause remains elusive in many cases, which makes prevention challenging. It's always best to consult healthcare professionals for personalized evaluation and treatment, as each case can be quite different. Remember, understanding these causes helps us better protect ourselves and reduce the risk of future strokes.